Okay, so this is a follow-up to my recent video about how the NHS is discriminating against male corona patients and that male patients are being denied ICU care because they're men. I put a link to that video in the description below, and in that video I mentioned that this is happening in Ireland too, and that I was going to do that video in the future. This is that video. So take a look at this headline. Point of no return, coronavirus in Ireland, patient ranked by point system weighted against elderly to decide who goes into the ICU. So basically, it's a point system. You can see here the patient evaluation process at major hospitals along the West Coast ranks patients by age and medical conditions and sometimes by gender, meaning it's a point system. So the more points you get, the worse it is, which means the less likely you are to get ICU care. The document then advises that if a patient has a score of over 8 points, they should not be admitted to ICU for intubation or medical ventilation. Men also receive, now here's where it explains how men get more points. So the people who are more likely to die are less likely to go to the ICU. So it explains how it works. Men also, on occasion, receive more points than women in the scoring system, with 1 point given to males aged between 50 and 60, and no points given to females in the same age bracket. The points climb with age, with 2 points for men aged 61 to 65, and 1 point for women in the same age sector. So a 50-year-old man gets the same points as a 65-year-old woman, even though he's 15 years younger. It goes on. 3 points are given to men between 66 and 70, 2 for women, 5 points for men between 71 and 75, and 4 points for women of the same age. And then again it says, a score of 8 or more makes the patient a poor candidate for intensive care and unlikely to be offered an intensive care bed. Now, this has been confirmed. This is an official document. You'll see the Department of Health made a comment, and they confirmed that this is, in fact, a real guidance. You can see a spokesperson said, the Department of Health published the guidance document Ethical Considerations Relating to Critical Care in the Context of COVID-19 on Friday, 3rd of April. The HSE has since disseminated the guidance across the healthcare system. So this is the guidance that's officially being used. The guidance aims to support clinicians in their response to a pandemic to ensure decisions are made in a manner that is equitable, reasonable, proportionate, and in compliance with national and international law, and which does not discriminate against particular groups or individuals. But that's exactly what it does. It's literally discriminating against men just for being male. A man will automatically get an extra point even if he is in relatively good health, just because of his gender. And remember, men are more likely to die from corona than women. In fact, they're twice as likely. This article from the Irish Times is talking about the mortality rates, and you can see a quote from Dr. Saber Klein. She said, people aged 75 and older were most at risk from dying with coronavirus. Men in that age bracket are twice as likely as women to die from the disease and account for a disproportionate number of dead. Well, maybe the reason why they're dying at a disproportionate rate is because they're being denied ICU care. Because remember, as that guideline said, if someone hits 8 points, they're very unlikely to qualify for an ICU bed. And a 75-year-old man already has a very, very high score because of his age and his gender. So the group that's most at risk is most likely to be denied an ICU bed. I can't help but think that if the genders were reversed, and if it was women who were more likely to die than men, the argument would be the opposite. The guideline would be the opposite. It would be that because women are more likely to die, they're more in need of the more intense care. They're more in need of ICU care, which is much more logical. But now that it's men who are more likely to die, they're less likely to qualify. That just doesn't make a whole lot of sense. As always, I have linked the articles in the description below.